Hi everyone! Welcome back to Face It with Dr. G. I'm Dr. G and I'm so excited to be here today. And if you guys haven't been over to our Patreon community yet, it is growing and growing and growing. Every day we get new members and it is so exciting. I love it so much. So if you're enjoying this podcast, which is unfiltered, conversational, high level expertise and advice, then you may want to head over to Patreon because it is just so much fun. And it was definitely a challenge, so we love that for us. But today I wanted to talk about skincare, and I wanted to talk about it in the teenage years, the 20s, and the 30s. And then our next episodes will be on the 40s, the 50s, and beyond, because we really need to understand the skin, how it changes, and what's a recommendation versus a requirement in my mind. And you can find a lot of these types of videos and reels on Instagram and on TikTok, but I thought it was my time to give you my 2 cents because I have a lot to say here, and I think there's a lot of misinformation out there, and even though we have so much content to look at, I think people are still confused and people still like watching them because I brought this up to the team and they're like, oh my gosh, I watch them every single time. So I was like, you know what, I need to do this. So we're going to talk about the teens first. And as teenagers, I actually recently had someone reach out to me to say, you should really consider a teen line because so many teens struggle with acne and it's all this over medication and over treatment and over drying and let's throw a ton of topicals at you and just see if one works. That's really not the right approach. And teens in general are obviously going through hormonal changes and the skin is baseline really healthy. So you have a really nice moisture barrier there. The skin has a lot of collagen and elastin and that extracellular matrix that allows for that youthful appearance of the skin. But when you start getting a damaged moisture barrier or acid mantle that keeps all of that moisture inside the skin, when that is compromised, you get cracking, you can get things like eczema, irritation, you can get dermatitis in other ways. When you have broken skin barriers, things like contact dermatitis can happen more easily and can be worse because your skin is compromised. It's not protecting you from all of these insults and allergens. So we want to be aware, obviously, of genetics and diet and allergies in general, because that our DNA kind of sets us up for success or failure, to be honest, with it when it comes to the teenage years and how we approach it. But my overall overarching theme is obviously sunscreen, because that is when we do all of the damage to ourselves that will then show itself in the later years as lentigines or those flat brown spots that we think are freckles that are just sun damage that has harbored and been festered deeper down in the skin layers. So I know it's really hard, and I don't know what I'm going to say to my kids when they're in their teenage years and how to get them to wear sunscreen, but there are so many options on the market now. You have things like Ilia, who has a foundation with, SPF 40 in it, and they're tinted now. So Elta MD has a bunch of different tinted colors to their sunscreens. So your skin has a beautiful hydrating sunscreen that is a universal tint that can go on all skin phenotypes. So find something that doesn't look and feel like a sunscreen. It's a base, a foundation for your makeup. It's a primer. And I love that. So in your teens, you must wear sunscreen, especially if you are acne prone, because those UV rays are damaging your skin, which are making your acne worse. The other thing is over cleansing and over exfoliation should be completely eliminated. So you want to gently cleanse your skin. Things like anything that says the word scrub in it. So, all of these things that you see in CVS with the word scrub. Let's be aware of what scrub means. When you over exfoliate, especially in your teenage years, you think that you're cleaning everything out and you're getting that acne away and you're helping it dry up. That is not appropriate. You want to nourish the skin so it actually can repair. Dry skin cannot heal itself and repair. So get rid of those crazy St. Ives scrubs, and there's other ones out there. There are some gentle exfoliation pastes. So your skin has a beautiful one. It's almost like sand crystals that are so fine, and it's not meant to be rubbed on your face on dry skin. It's best to incorporate that into something like a creamy cleanser to help just gently break up the dirt and the grime and the debris. However, if you're acne prone, again, I would stay all the way away from those. I would use something to exfoliate and extract that has kaolin or clay in it. So we have a gorgeous mask exfoliant by Sawyer Skin that's clay based, and clay adheres to and is attracted to oil and grease and dirt in the pores, and it makes it accumulate and it brings it out of the pores. So, and it's so gentle, it's not a scrub of any sort. So something like that can help pre-treat your skin when you're acne prone, using a gentle cleanser that has a gentle exfoliant in it, a chemical exfoliant, aka you're not rubbing your skin. Those are physical exfoliants. So a chemical exfoliant like, let's say, a glycolic acid, which is super gentle but super effective, or a salicylic acid. So those are hydroxy acids. You have salicylic acid, which is a beta hydroxy acid. It can get into the pores and it can get after that Cutibacterium acnes bacteria that causes inflammation, and it's one of the factors that aggravates and causes acne. And you can use the superficial chemical exfoliants like glycolic acid, lactic acid, and those are great. So my recommendation would be, in your teenage years, acne prone skin, use a gentle mask once a week that has clay in it, a creamy based cleanser that is conditioning. So we have a beautiful conditioning face milk by Sawyer Skin. It's kale based and has gentle brighteners in it. One of them is lutein, which is a natural brightener, and vitamin K, which is a gorgeous antioxidant. When you wash your face and you wash that cleanser off, it should feel soft, not tight and dry. So that is a key indicator if you feel, if you know that your skin is either retaining water or losing water. So you want to retain water in all types of skin, but specifically acne prone. So a gentle cleanser, let that, gently blot your eyes, and then you're going to start into your serums. But again, teens you want to have simple ingredients and few products, so you're not overdoing it. So a nice cleanser, use the creamy one, I would say 5 days a week, and then 1 day a week use a chemical exfoliant, a cleanser with something like glycolic or lactic acid in it. We also have a beautiful one of those, it's nettoyant exfoliant. So alternating between those two. Then you need to hydrate. So you need to use a serum that fortifies the skin with hyaluronic acid and niacinamide. So those two ingredients are powerhouses because the hyaluronic acid is supreme hydration, and the niacinamide is powerful because it will help prevent the post-inflammatory hyperpigmentation that can occur after inflammation from acne. So it can both prevent pigment and it can help lift pigment. So niacinamide is another powerhouse ingredient, and in our Formula Juness, and I'm sure there's a ton of other products out there, but we combine those two for that specific reason because it helps combat hydration and pigmentation, or lack of hydration and overpigmentation, hyperpigmentation in the same formula. So let's say you now have cleansed, now you're hydrating. This is where you may want to put another active ingredient on. So a lot of acne prone patients will be prescribed things like adapalene, Tazorac, Differin. Those are spot treatments that help combat acne. They're also super drying. And so I think it's best to try and increase the health of your baseline skin. You'll see your acne improve. And if you have stubborn areas, you can still use those spot treatments. But I would not recommend applying those all over your face every single night. You're going to completely dry out your skin and cause maybe temporary relief of acne, but likely rebound when you stop using it. And that's not what we want. So after you apply maybe a spot treatment, then we get into a retinol, which a lot of teenagers don't use retinol, but it is something that I highly recommend. It helps with superficial exfoliation, it helps with skin cell turnover, and it helps with collagen production. It is wonderful for acne. It is not a product that works overnight. It takes time to work, but I would also recommend a retinol at least once or twice a week in teens with acne. And then hydrate, hydrate, hydrate. So a cream that helps lubricate, an emollient that helps smooth the edges of the skin, helps with overall hydration, and helps lock all of the other ingredients in that you have already applied to the skin. So those are my recommendations for teenage years. In patients or teens that don't have acne, I think hydration is key. Sunscreen is key. As much or as little as you can do in your teenage years will really affect the outcome of your skin later down the road. So sunscreen is really, really important. I know it's hard, but just try it. It's really important. So then we get into our 20s. And The 20s, which are very similar to the teenage years, are when we start to either phase out of acne or still deal with acne. So I would say a lot of those concepts still apply in your 20s, but when you get into your late 20s, this is when you really want to get very serious about sunscreen and retinol. So fine lines and wrinkles start developing in your 20s. It depends on how much you care about them. Do you care or not care? But retinol and sunscreen actually have way more clinical benefits than just the aesthetic appearance of how your skin looks. They help with obviously preventing skin cancers down the road, both melanocytic and non-melanocytic, which are the squamous cell carcinomas, and basal cell carcinomas, which are very, very common. So late 20s, definitely apply your sunscreen at the end of your skincare routine and before any makeup in the morning. At night, you obviously don't need a sunscreen. At night, it's more of your retinol. I recommend starting with a 0.025% either retinol, or you can start with a 0.025% tretinoin. Tretinoin is the active ingredient. It's stronger, wham bam, right to your skin, whereas the retinol has to be converted into that retinoic acid as it is after it's applied. So it takes a little bit longer to get to the active ingredient, but the end result is the same. So whichever works best for you. I don't recommend starting with the active ingredient and then getting so dry and irritated that you have to stop it. That's not the goal. So slow and steady wins the race here. Okay, so one more note about the 20s. So we really at age 25 start losing a significant amount of our collagen each year. That's why the retinol and the sunscreen are super important, specifically after age 25. Another thing that you can start thinking about in your late 20s are those preventative treatments that can be helpful to keep you fresh and youthful. Things like hydrofacials, just so that you're extracting and cleansing and hydrating during this awesome treatment, so that your skincare products that you're spending a lot of money now on, or more money than you used to, are working better. So that's a really nice recommendation. There's some great peels out there now. We offer both VI peels and BioRepeel. BioRepeel is fantastic because it exfoliates and causes turnover of the skin cells, but it also hydrates at the same time. It's awesome, and you don't peel. Some people will peel the teeniest, tiniest bit, but you really don't peel. You look amazing and tight and plump right after the treatment. It's awesome. So that's something to look into. And then other things that would be great are things like gentle lasers. So clear and brilliant lasers, a fractional laser that there's no downtime, but not only does it help with superficial lines, wrinkles, it helps with tightening and constriction of the pores, with redness and rosacea and telangiectasias around the nose, but it also is preventative for skin cancers. We found that this helps pre-treat the skin. So the patients that are more religious about these types of lasers, the fractional lasers, they are less likely to get these skin cancers and precancers. So now on to the 30s. This is when we start to say, okay, I feel like I'm changing. I feel like my skin is changing. Maybe you've had a baby. Maybe you're trying to have a baby. You're in the process of having a baby. And after that, you really start to see obvious changes. And those are typically presented to me in the sense of, I just feel tired. I feel like I look dull. My skin isn't as plump anymore, you know, all of these things. And that's why the 20s are so important, because it really does creep up on you. And while the 30s, you're still young and there's still a lot we can do and get you shining brightly in every way, it's nice to get onto a nice skincare routine in the 20s. So in the 30s, we have started to lose more collagen. We have started to develop some fine lines and wrinkles. Our muscles have created memory, our muscles of animation that in some way are in our genes, right? You'll see that the lines that you form on your face may be similar to the lines that your parents have on their face. And you'll just start to notice these things. So how do we get on top of it? What is the best strategy? So in the 30s, it is not a recommendation anymore. It is a requirement in my eyes that you are using a sunscreen and a retinol. If you're going to come in and drop thousands and thousands of dollars in a practice with treatments, you have to maintain your skin at home every single day, or it's a waste of your money. So a retinol, again, as I mentioned before, same sort of process. I recommend once a week at night, get up to every single night with your retinol, and we can increase the percentage accordingly of the strength of the medication. And what else? So you can start incorporating a lot of other products in your 30s that really help optimize your overall skin health. In your 30s, you're going to start to see some pigment show. And that's either from acne you've had or that's from sun damage in your 20s and your teens. So this is where we get into more significant brighteners and lighteners. And those can also have benefits for collagen stimulation and all of that, but you want to look at the actual ingredients of your brighteners, because different types of brightening ingredients work on that brightening pathway in a different way. And it doesn't make sense to buy 3 products with different quote unquote ingredients, but they all work on the same part of the pigment pathway, if that makes sense. So we have brighteners that help and prevent pigment formation. So that's melanin. We don't want to have any melanin. We want to prevent it. So those are tyrosinase inhibitors, and those are things like arbutin and licorice root and kojic acid and niacinamide. There's a lot of other ones, but that helps prevent pigment. So you want to always have that on board. The other thing that helps prevent pigment, obviously, is sunscreen. So SPF at least 35 to 40. I say 50 usually, but at least 30. Okay, none of this 10, 15, 20. That is not doing you any good. So sunscreen and those tyrosinase inhibitors. Then, and we have really amazing brightening pads with Sawyer Skin that we make custom for you here in the office. They're awesome. So if you guys want any recommendations, we ship nationwide, let me know. So the next step of pigment production is transfer from the melanocyte into the keratinocyte. So a little bit more superficial so you can actually see the pigment, or deeper into the dermis, and that's where we get things like melasma and post-inflammatory hyperpigmentation. So in melasma, you get these pigment-laden macrophages in the dermis. Same with post-inflammatory inflammatory hyperpigmentation. That pigment drops out of those melanocytes into the dermis and is engulfed by these melanophages that are trying to destroy the pigment, but it just sits there for a while, and you get these pigment spots that are seen clinically. So how do we, help with that step? So that's also niacinamide. So now you have niacinamide working on 2 of the steps of melanin production and transfer and pigment production. And then the last step is exfoliation. So that's where you get your retinol, your retinoid. You really want to help with that superficial exfoliation. You can use your glycolic acid and your other chemical exfoliants, but that's really important for that step as well. So overall, I think in the 30s, we're really starting to focus on pigment correction. And you need to understand, like I just went through, there's a lot more to talk about there, but understand what types of ingredients you're putting on your face. A vitamin C is great, but also vitamin C is super unstable of an ingredient. It needs to be stabilized by things like ferulic acid and other antioxidant ingredients like vitamin E. So having both of those is awesome. We also have an amazing vitamin C. So talking to someone who really understands these things is crucial. The other thing that I find with the 30s is collagen collagen depletion. So people feel they look like they have more shadows on their face. They feel a little bit more sunken, and that's from a collagen standpoint. And from a treatment standpoint in office, you can do things like microneedling and laser, both radio frequency microneedling and things like skin stylists that don't have that radio frequency energy. There are some contraindications, so you want to be aware of those. And then superficial peels like the BioRepeel. These are all really awesome. Injectables like Sculptra and Radiesse that help build your collagen over time are also amazing. Okay, and so when it comes to collagen, from a topical perspective, you can take oral collagen supplements, which are also great, but every other organ needs collagen before your skin. So topically is the best. So you want to both prevent degradation of collagen and you want to help gently promote collagen. So the promotion of collagen is by your retinol. So again, that's super, super, super important. And then prevention of breakdown is your sunscreen. So I'm coming back to in your 30s, let's get some really amazing brighteners. Let's get your retinol and your sunscreen on board. Those are your powerhouses. Then obviously we need your hydrator. We need a really gentle cleanser not to strip your skin moisture barrier. And we need some really nice hydrators that are not super thick to clog your skin, to clog your pores, because you want your skin to breathe as well, but also be super moisturizing. I hope that helps. I went through a bunch here, and those, obviously there's a lot more to this and I could talk for hours about skincare, but in general, in the teens, it's more about acne prevention and management. In your 20s, it's also about continuing that acne prevention and management and then really thinking about sun protection and collagen stimulation with your retinol, and then into your 30s starting to possibly see some pigment abnormalities. How do we treat that in office, and how do we really address it at night in the proper way without just throwing a vitamin C on? One other product that I would like to recommend is for the periocular area, an eye cream. So we all like eye creams, but we have to know their limitations. And when it comes to the under eye skin, it's the thinnest of the body, 0.3 millimeters in thickness. And we need to be aware of that, both when we're cleansing our face. You don't want to over traumatize the skin, which an oil cleanser is actually a great idea for that, because you can melt that makeup off without rubbing. It's beautiful. Check out Sawyer Skins also, it's really, really great. But in general, the eye cream should have ingredients that fortify proteins and protein growth and building of proteins. So we have one that's 300 plus proteins, peptides that are specific for the skin to help fortify that under eye and periocular skin. It's actually safe for the eyelids as well. And it thickens the skin gently, hydrates it, helps with the crepiness and fine lines, but also gently thickens it over time. So be aware of false advertising when it comes to eye creams that get rid of puffiness and darkness, because they're limited, and if they do work, it's obviously and usually very, very temporary. So use something that you can use for a long time. I hope this helps. So let me know if you have any questions. I can go in depth into the teens more, the 20s more, or the 30s more, but the next couple episodes will move on to the other decades. I hope you liked it. Enjoy. Head to Patreon, like, subscribe, share. I'll see you guys next time.